on the field and they suddenly pull up lame, you've got to make a quick assessment to be like, okay, potentially which leg's lame, and then what stance are they in? So are they holding their leg with one leg extended? Are they potentially toe touching? Are they completely not weight bearing on a leg? Or are they maybe just really restless and shifting their weight around? And then when you're counting your respiratory rate, either you can look at the nostrils, like if they're puffing, it's going to be quite easy to take that. Or in most horses, from a distance, you're actually looking at this area here. Can you see him breathing in and out? So going out, in, out, in, out, in. Because the horse's diaphragm covers in this area here, so as it expands and contracts, we get this movement at the bottom of the belly. Now what I tend to do is I tend to just count how many breaths there are for 15 seconds and I times it by 4 to get a full minute value, but if you want, you don't want to do the mental maths, you can just times it for the minute. Then you want to get your stethoscope, and to take the heart rate, you always want to do this standing on the left side of the horse. You can still get a heart rate from the right hand side, but you're going to hear some slightly different heart sounds and it's a bit quieter, so the left side is always the best. To get the right location, you want to find the point of the elbow here, and then you're going to put your stethoscope.
Obviously didn't play hard enough, mate. I knew you were taking it easy.
That's out of the
Carrying you.
Cool, so once you've found this point of the elbow, then you're going to be putting a stethoscope here on the chest. Now, if you're struggling to hear it, don't be afraid of going really underneath the armpit, because sometimes the heart can be tucked quite far under there. And use as much pressure as you can, putting the bell of the stethoscope against the side of the chest. So you're going to come in, put your stethoscope on, and what you'll be able to hear are two noises. There's a lub and then there's a dub noise. Now the horse's heart is pretty big. It's about this size. So obviously there are multiple noises just for one heartbeat alone. So that lub dub sound, that counts as one beat. Some horses can have up to 4 heart sounds. If you hear that, it sounds like they're galloping, like. But again, that's just one heartbeat. This is why it's really handy to just practice this on multiple horses just to get your ear in. So once you've counted your heart rate, and again, count over 15 seconds, times it by 4, or do it for a full minute. Then with your stethoscope still on, you want to have a listen to the gut sounds. So here where the horses have this perfect whirl, this is where we listen, so right on their flank. You can also feel along the side of the rib cage, and once you get to the end of the ribs, if you just plop off the end there, that'll be your first starting point. Now the horses have got about 30 metres of intestine going on inside of here, so we've got to listen in multiple locations in order to get a good idea of what's going on. So the first spot, the left dorsal area, we listen to here, then you drop the stethoscope down about 8 inches and listen at the left ventral spot. Now this top left corner, it's always the quietest out of all the quadrants because we've got mostly small intestine in this area. So you might only hear 1 or 2 rumbles within a 60-second period. But then as you move your stethoscope down, you should hear a lot more going on.
So which part?
Now once you like a lot of the ponies today are going to have quite quiet gut sounds because they're out. They might not have eaten as much as they normally would, and they also would have played. So a few little noises there. Come around onto the other side, and then you repeat the same thing. Easy. Okay. There you go. So his gut sounds are much louder on the right hand side. So once you've taken your gut sounds and you come to the head, just have a quick check for symmetry, make sure that both the eyes are open, you don't have any discharge from the nose and the eyes. And then you want to check the mucous membrane. So the best way to do that is by lifting up the top lip. Some horses are more tolerant to this than others. And he's got nice pink gums and they've got like a slimy covering over them, which is great. So I'd call those pink and moist. And then I'm going to press my thumb onto his gum to get the capillary ready for time. Just like that, good boy. 1, 2. And the colour comes back within 2 seconds, which is normal. I know, dude. Yeah, the last way you can assess dehydration is by coming down to the bottom of the neck, and always do it from the line in front of the shoulder. Just take a skin pinch and let it go back. So his actually took a couple of seconds to go back to normal. So I'd say he's got some early symptoms of dehydration. It's a good drink in this warm weather. And then once you've done that, then you can check your digital pulses. So it's worthwhile doing this on all 4 feet, like I said, just to check if they're balanced. And the way I do this is I come down the leg. I've got a couple of grooves, like now. We've got a groove here that's between the cannon bone and the suspensory ligament. And we've got another groove here which sits behind the suspensory ligament going into the flexor tendons. Now the palmar and plantar digital veins and arteries, they run down this groove over the side of the fetlock and into the pastern. So I get my thumb and my forefinger and I use it to check the digital pulse as it goes over the side of the fetlock. And the way to know that you're in the right position is if you get to this location and you move your thumb forwards and backwards, you'll feel it plucking under your thumb like a guitar string. So that is the actual vein artery nerve bundle.
Do you have to be careful with your thumb because you can feel your own pulse?
Not really in horses.
Okay.
Yeah, it's an issue in people,
Yeah.
but horses not so much.
Okay.
And then you want to apply medium pressure. You don't want to be squeezing as hard as you can because you're going to block the blood flow. You don't want to just be lightly placing your thumb on there because you won't feel anything at all. Oh, yeah.
So what's the difference between taking it there and taking it near the back of the heel?
There's no difference.
Okay.
The only thing is that I think it's easier to get a consistent pulse here. Like I go out, sometimes I'm seeing a Clydesdale, it's like good luck to me trying to find a pulse down here.
Yeah.
And I'm like, it also means that you can feel that vein artery bundle. So if you can't feel a pulse, but you know you're in that location, you know that the horse just doesn't have an obvious pulse. So I like to do that for consistency. But if you find it easier going for the pastern, then knock yourself out.
Okay.
Then, last but not least, you want to do the temperature.
Oh boy.
This is always a fun bit. So obviously you want to avoid just walking straight up behind the horse and taking this from the back because this is one of the times where you can get kicked. So I stand side on. I use my right hand, so I tend to use my right leg to balance and can lean onto my right hip. Run my left hand over the base of the tail, move it to one side. You get an idea of where I'm aiming for. And then I pop the thermometer in. And you can put a bit of KY jelly on it if you want to make it a little bit nicer for the horse, but I don't need to worry about that too much. Now a horse should normally sit between about 37 and technically 38.5 is the upper threshold. If I've got a horse that's 38.5, I'm at that point then classifying that they've got a fever. If they've been running around on the polo field, it wouldn't surprise me if they're in the mid 38. So I'd actually give them 10 minutes, I'd cool them off with some water, then retake the temperature there and see where it fits in. That's also a really good thing to do if you're dealing with a horse that's got heat stroke, like we were talking about. Take the temperature every 10 minutes and keep going with your cold water therapy until you've brought them back down into the 37s. So what you can do is you can write all your findings down on your sheet while you're doing this, and that then gives you like your full horse health assessment, and that then allows you to keep track of what you're doing, because when you're in the heat of the moment, it's really hard to retain all those figures. So what we can do is, anyone who wants to give this a crack, I've got a bunch of stethoscopes, some horse health assessment sheets, some thermometers, so we can just divide up into some groups and you guys can practice this on the horses.